You mentioned the growth of the exponential nature of it, which we've expected, but think back, Sunday night we reported 45 confirmed coronavirus cases in Michigan.
And this afternoon, now we're confirming 549 cases. The numbers have skyrocketed all week, and that trend is sure to continue. That's why hospitals in Metro Detroit are preparing for more and more patients. Sean Lay joins us live outside Ascension Southfield, just one of the many hospitals working out of tents. Sean.
And working hard to keep people inside the hospital, patients already here, and their hardworking staff safe. So Ascension today putting blue tents outside their emergency room system-wide, meaning if you're coming here with coronavirus type symptoms, you're not going to be able to walk into the emergency room. You're going to that tent to be screened first. This is the new normal for now. Triage areas now set up outside of every Ascension, Michigan hospital like this one in Southfield. You'll see the same triage tents at Ascension locations in Madison Heights, Ascension St. John, Ascension Providence Rochester, and their location in Novi. This is part of the hospital's emergency preparedness protocol. The goal, to distance people who think they've been exposed to coronavirus from the rest of the patient population, from the staff, and from healthcare workers. Ascension doctor Sean J. Ocker says the triage tents outside are key to keeping people safe inside.
I think it's a really good idea so that we don't have our ERs inundated with people with COVID-19 and they will spread the virus to more people and we'll have more infections. So it's good that we have a system in place where we can triage these people, and the ones who need to be hospitalized will be hospitalized. And those who simply need instructions will be given the instructions and then they can go home.
That means if you feel that you have coronavirus symptoms, call your doctor first. And before you set foot inside a hospital, you'll be first checked out inside one of these triage areas. We saw the same thing at McLaren hospitals here. No one is allowed to walk into the emergency room without being checked for COVID-19 symptoms first. It's all about treating people, but stopping the spread. Again, bottom line, if you're coming here after talking to your doctor with those symptoms, you're going to be screened in a tent, much like many other hospitals in the area. And there's a good likelihood you may be tested and then even sent home waiting for the results of those tests. I'm told people who are very sick will be taken to an isolated room. We're live tonight in Southfield. Sean Lay, Local 4.
Yeah. All right, Sean.